Hello, good evening. Um, so I know again a long weekend, so so many classes have not been done. So I'm trying to keep up the pace, but yeah, something or the other comes up. So yeah, so good evening to all. I hope all have celebrated the Rakhi festival and all. Yes, so going to the drug exactly, it is ammonium carb for today. So we'll be dealing ammonium carb and ammonium mure also. The next video will be on ammonium mure exactly. Common name is smelling salts. Yeah. So we have this classic description of some lady having some smelling salt or some smelling bottle in her hand, who frequently catches cold in especially winter seasons. Right. So old method, it comes in the class 5A, and new method, yes, drug strength is 1 by 10. Okay. So constitution, yes, we have a stout fleshy woman with various troubles in consequence of leading a sedentary life. Delicate woman um, who have the smelling bottle continually at hand, readily catch cold in winter. Alright. So as we said, this is the usual picture how they depict ammonium carb. In mental drills, I think there is ill humor during wet, stormy weather. So you just need to remember, ammoniums are usually very bitter. Very yeah. We say they are very bitter in nature. Okay, so that is why they have this kind of mind symptoms. And definitely, please remember, wet weather aggravation. You have this ammonium carb as one of the leading remedies. Okay. Physical generals, this is a remedy that has profuse hemorrhage, and that hemorrhage is, there is degeneration of RBC, and there is ulcerations even to the level of gangrene. So you have hemorrhagic diathesis, fluid, blood, and degeneration of red blood corpuscles, and then you have ulceration tendencies to gangrene. Children dislike washing. Other remedies are antimcrude, sulfur. Alright, so another important symptom of ammonium carb. Okay. In head, you have headache, sensation of fullness as if forehead would burst. Okay, so forehead would burst. So there is some kind of fullness in this kind of region, the frontal part. And then you have Belladonna as well as Glonoine having same conditions. Alright. Yeah, both Bell and Glonoine are having some troubles also. So please remember that. In the nose, we have this hemorrhagic tendency. So obviously it's nosebleed, epistaxis when washing the face. Other remedies are arnica, calicab, and maca. It's not only just washing the face, even in the hands. Washing the hands in the morning. Can be from the left side of the nostril after eating. Okay, so you have so many modalities for nosebleed. You have osina, blowing bloody mucus from the nose frequently. Blood rushes to the tip of the nose when stooping. So you have this kind of stooping aggravation, and what stooping causes? It is causing epistaxis. Alright, and also you have this osina, that is kind of offensive nasal discharge, usually seen in atrophic rhinitis and all. Then you have stopping of nose mostly at night. Another important symptom, frequently that comes up in OPD. Must breathe through the mouth, a keynote even in diphtheria. So there are various types of diphtheria. Now imagine the ammonium carb patient have a nasal diphtheria. So yeah, or nasopharyngeal diphtheria. They will definitely have this obstruction. Now diphtheria has a false membrane, and then if they have this obstruction of the nasal column, and then that causes obstruction of nose. Alright, so you have stopping of nose mostly at night, must breathe through the mouth, and there is long lasting coryza and snuffles of infants. Another very important symptom of ammonium carb. Other remedies are heparin, naxomic, Sambucus sticta. Alright, so very important symptom of ammonium carb, that is snuffles of infant. Okay. Please note down the other remedies: Hepar, Nux vomica, Sambucus as well as sticta. In the throat, you have a putrid sore throat, tendency to gangrenous, ulceration of tonsils and glands are engorged. So definitely you have this, severe inflammation of the tonsils up to the ulceration and gangrenous inflammation and all. And in inferior or scarlatina, when the nose is stopped, okay, and child cannot sleep because it cannot get its breath. So definitely we said that stopping of nose at night. So again, this is the repetition. In female, yes, they have very characteristic cholera-like symptoms at the commencement of menstruation. Okay, other remedies are Bovista and Veretra. But to say about ammonium, you have especially ammonium carb has this description: cholera-like symptoms. If you go for ammonium mure, there is diarrhea. Okay, so yes, cholera has diarrhea, but then if you want to stick to the exact words, I will suggest ammonium carb, Bovista as well as Veretra. If you go for ammonium mure, you will see the word diarrhea mentioned. Alright, but they have not mentioned the type of diarrhea. Okay. Now in menses, you have so many things to be noted down. It is profuse, it is early. Yes, it has a gripping colic that comes before the menses. Now how the flow? It is very profuse. It is acrid. Now since it is acrid, it makes the thigh sore. Okay. Now if you go see for ammonium mure, you will have a nose discharge making the lips sore, just like Allium cepa. Now, so this speaks of the group ammonium. Okay, it's very bitter. It's very acrid discharges. It is hemorrhagic in nature. So in menses also, it is copious at night and while sitting. Okay, another symptom shared by Zinc-Med. Menses is attended with toothache. It is attended with colic, sadness. Okay, and then there is something fatigue, especially of the thighs. So you already have an acrid discharge that makes your thighs sore, and on top of that you have fatigue, especially of thighs. And then along with that you have concomitants like toothache, yawning, chilliness, colic. Again colic will go as accompaniment, but then I will say concomitant should be toothache, yawning, chilliness. Okay. Leukorrhea, now again mentioned as watery, burning from the uterus. Again, that is acrid, profuse from the vagina, causing excoriation of the vulva. Okay, so please take this thing in mind. Ammonium carb discharges are acrid. Okay. In respiratory, one of the important remedy for emphysema, pulmonary edema, dyspnea with palpitation worse by exertion is common. On ascending, that is again common, even with a few steps. Okay, speaks of its intensity of dyspnea. Worse in a warm room. One of the best remedies in emphysema, the cough is dry. Now how that cough is described? As if something is tickling in the throat as from the dust. So you know how dust is, and if it settles in throat, definitely you feel like clearing dust, right? So it's kind of a tickling sensation in the throat that causes a dry cough in the patient. Now when that cough comes, it is between 3 to 4 a.m. in the morning. So imagine the distress that patient has. Okay, so ammonium carb has a very distressing dry cough caused by the tickling of throat sensation as from a dust. Okay, and the time that patient is having the trouble is 3 to 4 a.m. Now Calicarb has 2 to 4 a.m. Aggravation, and this guy has 3 to 4 a.m. Okay. Now loses breath while falling asleep, must awaken to get breath. It can be due to a cardiac issue, it can be due to a nose block issue also. So nose block, because nose is stopped at night and has to breathe through mouth. That one description is already done. And again, ammonium carb is a remedy very important for pulmonary edema clinically, and it's given in boric also. So please correlate with the nocturnal dyspnea due to cardiac complaints. Alright. In extremities, you have panorrhesium, deep-seated periosteal pain, also seen in Diascoria and Silesia. We already know that, and I think we should not be spending much time on the single line symptoms. And then you have skin, less dig area of ammonium carb. It is mentioned body red acid from scarlatina, compare Helianthus glandulosus. Now that remedy has livid rash returning annually and disappears on pressure. The rash disappears on pressure. Not a very much important symptom of Helianthus, but you have to know something about Helianthus, that it is a remedy, very good remedy for follicular tonsillitis and all. You give as mouthwash or gargling and all. So you tend to get throat complaints more in Helianthus. Alright. Then you have malignant scarlatina with deep sleep. Okay, malignant scarlatina with deep sleep, stertorous breathing, miliary rash or faintly developed eruption from defective vitality. Very, very important symptom, something that we tend to forget. We always remember about zinc met, we tend to remember about cuprum met, but not about ammonium carb. You have defective vitality that makes the body difficult to bring out the eruption. So faintly developed eruption from defective vitality, that ultimately can cause a threatened paralysis of the brain. Okay, and now paralysis of the brain is something that you tend to come up with the epilepsy or spasms. Now that the most important remedy is zincum. You also have tuberculum as well as sulfur in the comparison. Alright. Now yes, about zincum, there is defective vitality, which many characters nature are too weak to develop exanthemata. Okay, and now there is one remedy, that is bad effects of repercussed eruptions resulting in brain affections. Okay, the remedy is cuprum met. Okay, bad effects of repercussed eruptions resulting in brain affections, that is cuprum met. You have defective vitality, so that the exanthema is not well developed. The main one is zincum. You also remember about ammonium carb, also remember about tuberculum as well as sulfur. Alright. Modalities, you have aggravation cold weather, wet poultices from washing, you have epistaxis. During menses, yes, there is enough and more problems during menses. Yeah, toothache, yawning, chilliness, sadness, colic, all those things are there. Amelioration is lying down on abdomen. Alright, so something shade just like your acetic acid. Okay, then you have lying on painful side, just like your bryonia, calcarica, pulsatilla. Then you have amelioration in dry weather, something opposite to the wet weather. Few points from boric. You have uncleanliness in the body habits because it dislikes washing, dislikes bathing like that. Okay, and great aversion to water, cannot bear it to touch it. Bleeding piles, again aggravation during menses, so that makes sense. Aggravation during menses. Yes, here you can see a particular symptom of boric, bleeding piles, aggravation during menses, and there is something also seen here, aversion to other sex. Another important remedy that you have to remember is sepia. You have to remember about raphanus. Okay, because there is aversion to husband. Okay, so please remember such remedies. So think of fear of other sex like pulsatilla. Alright. Relations here, it handles poisoning with rust ox and stings of insects. Important relation, affects the right side most. Another important thing, and it is inimical to lysis. All three symptoms are important. Okay. The questions here, which of the following does not have the symptom? Toothache during menses, chamomilla, mac-carb, ammonium carb, and staph aureus. See, we know chamomilla and staph aureus is keynote symptoms. Ammonium carb, we said that during menses there is toothache. Okay, not exactly toothache during menses is given here, but menses with toothache it is given. So it is a derived question. So the easy answer is mac-carb, which shows toothache during pregnancy. Also another remedy should be ratania, that should be kept in your mind. Okay, mac-carb is the answer. That does not have toothache during menses. What is true regarding the characters of menses of ammonium carb? Menses flow during the morning, flow during daytime, but lying down, better by lying down. Menses flow only at night, not at daytime. Copious at night and while sitting. The answer is D, option D. Okay. And then you have cough racing, blood, suppression of menses, hemorrhoids. Okay. So this is mellifolia. Okay. Thank you.